Thank you for a wonderful panel, and thank you to all of our benefactors. Um, Avi, Ilana, Steve, Didi, Lapo, Chris, wonderful, wonderful information that was shared. One of the coolest things and the things I love about IHE is that we really act globally, act locally while contributing and collaborating globally to make interoperability happen. So with that, after we've seen what's happening at the national level, we're going to go into a more specific use case, one that's really become a worldwide initiative that's gained attention across the globe. We're joined here today from Vancouver by Mike Nussbaum, who is the IHE International Board Member and longtime collaborator of IHE. So Mike, off to you.
Thank you, Christina, and welcome everybody. I can't tell you what a pleasure and an honor it is to be a part of this and to be hosting this particular section of our presentations today. I'm a proud Canadian, and it's really great to welcome everybody here in North America from sea to sea to sea to sea. We don't often get a chance to say that. I welcome all participants from around the world, of course, as well. This topic is something that I think we've all been hearing about. You've heard about it already in the presentations that preceded this. It's one of the key topics that we're all focusing on in our digital health worlds today around the world. And so if we could have the next slide, we're going to delve into a little bit about IPS and how IHE relates to IPS. I'm sure there's nobody on this in our digital health world on this planet that doesn't know what the International Patient Summary is. Having said that, I put some definitions on the slide. Again, these are leave behind slides as well to make sure that we all understand what IPS is. I'd like to highlight a few things. It is a worldwide initiative. It involves many, many stakeholders, including those of us in the standards communities, all of the SDOs, that standards development organizations that make up the standards community. Many of us are involved in this. Government agencies we're going to hear are very engaged on the International Patient Summary, and also implementers and those that deliver healthcare services are increasingly looking to the International Patient Summary as a means to communicate across borders and across the street. Patients also are increasingly interested in making sure that they have knowledge of and access to their patient summaries whenever they engage with the healthcare system. All in all, this is considered a very vital component of digital health, and I'm very pleased and happy to be part of this initiative and part of today's presentation. The International Patient Summary is international, and so we have a great deal of engagement from around the world. I've named a few here. We're going to hear about the GDHP, but I wanted to highlight, in fact, the G7, who in June 2021 put out a statement that specifically called out the International Patient Summary Standard. And that was a great uplifting comment for all of us that have been working on this. I'd like to remind everyone that the use cases around the International Patient Summary are not just across international borders, but many, many countries are are implementing this on a national basis, like Canada's doing that and others as well. And it also use cases can be local and regional. So in fact, you could have two health systems that want to communicate across the street in the same jurisdiction. There are many, many implementations underway worldwide. We'll hear about some of these when our speakers present. Just one other thing, I wanted to bring everybody's attention to the internationalpatientsummary.net website. It's at the top right-hand corner of the slide. It has everything you always wanted to know about IPS, including all of the things that are talked about in today's presentation. To carry on then, I'm going to have a standards development organization perspective here, and I think we've heard that we've had probably unprecedented collaboration that I've ever seen in my many decades of work in this industry between the SDOs that have come together to put together an infrastructure, an ecosystem really of standards that support the International Patient Summary. Currently, there are 5 major SDOs that are participating internationally. They've each provided standards artifacts. They're all shown on this slide. IHE is very proudly represented by 2 profiles. There's an IPS content profile and a brand new shared IPS profile that you're going to hear about later on in this presentation. IHE is very, very pleased to have joined with others in leading these developments and providing these standards artifacts. This Connectathon is a great place to be able to guide implementation through conformance testing. And of course, the Connectathon is definitely part of the conformance testing continuum. There are 3 vendors currently on the Connectathon floor that are testing the IHE IPS profile. And every one of the IHE Connectathons worldwide will have an engagement with the IPS profiles and other standards artifacts going forward. We've seen some in the past. We will see more coming up. And that's not just in the IHE world. There are many others that do this. HL7 has FHIR Connectathons that always highlight IPS. And there are other organizations like the GDHP, which IPS is a major pillar of their program. Again, SDOs collaborate not only on the development, but on the maintenance and growth of IPS artifacts. We get together every 2 weeks to talk about those cross SDO issues so that we all stay in sync. And we have this IPS website. The Joint Initiative Council that's listed on the top currently has 13 international standards development organizations as members. And the Joint Initiative Council, or the JIC, the website is listed there, also is providing support and infrastructure to allow this cross-SDO collaboration going forward. Just wait for the next slide to come up. There we go. So we have a stellar panel today, and I'm very, very pleased to welcome Herco Koemans, who will represent the GDHP perspective. He is the secretary of the GDHP now, and he's based in the Netherlands. Talking with Herco will be, after Herco will be Matt Ron. Matt Ron is well known to all of us in the US. He's with the Office of the National Coordinator, and he is a standards guy and very, very active in IPS. We see him in all our meetings. And finally, with John Murky, who most people who in IHE and HL7 know John very, very well. He crosses all these lines, and he has been the primary author of the sharing of IPS profile, the SIPS profile, which we'll hear about later. Just before I pass it over to Herco, I just want to say that our speakers are highly qualified to overview the current state of IPS and its importance as a key enabler of digital health across the globe and across the street, and how vital it is that we continue to collaborate in its development, implementation, support, and continuous improvement. Reminder, Q&A, we will allow for questions to be raised in the chat, and we'll pick them up if we have time at the end of the panel. So with that, I'd like to turn it over to Herco.
Thank you, Mike, and thank you for this opportunity for me to present at the the North American Connectathon from IHE. As Mike said, my name is Herco Koemans. I work at the Dutch Ministry of Health, Welfare and Sport, and the Netherlands is currently the chair of the Global Digital Health Partnership, the GDHP, and with the chair you are also the secretariat. So that's why there's a double role there. Next slide, please. So why is the GDHP interested in the IPS, in the International Patient Summary? This comes from the G7, the biggest economies of the world, that had under the UK presidency in 2021, they sort of adopted the IPS as a global standard to exchange a minimum health data set for patients' health information, to exchange that data set. This, of course, was a direct result of the pandemic, and that everyone said, well, we need to have more global exchange of health data for our patients, and how do we address this? There's this wonderful thing already out there that's called the IPS. Why don't we just take that and use that as our main carrier for the next developments? Next slide, please. They asked, the G7 asked the Global Digital Health Partnership to speed up and accelerate the adoption of this IPS. But there's other organizations, as Mike mentioned already, there's other organizations that have jumped on this bandwagon already. One of the biggest ones that have currently are working with the International Patient Summary at the global level is the World Health Organization. They have launched their global digital health certification network that is geared to exchange certifications for vaccination data that contains IPS data as well. So they use the IPS as their standard to exchange patient data that is related to vaccinations, but they want to exchange other types of patient data in this certification network as well. Like I said, the G7 is in there that have adopted the IPS and have asked the GDHP to work with it. And the European Commission is also dedicated to the IPS because it's part of the network of national contact points that every European nation is now implementing, and it will be part of the European Health Data Space regulation that is a European law like the GDPR is, but then for the exchange of health data. And on the bottom there you see the GDHP. Mike already talked about the Joint Initiative Council. Next slide, please. So what is the GDHP? And I will be brief about this, but the GDHP is a network of national digital health authorities. So these are all ministries and public agencies of 36 countries across the globe. And we also work with the WHO, the OECD, and Health AI. And there's other organizations that want to become a collaborative partner of the GDHP as well. And because it's from across the globe, we have members from US, Canada, Brazil, Saudi Arabia, across Europe, the UK, which isn't Europe anymore. In Africa, we have Nigeria, there's the Seychelles, all the way through Asia, in India, Indonesia, Korea, Japan, Australia, New Zealand. So it's truly across the globe. And there's becoming more and more of a diversity of members from their digital health maturity, which I think is really good that we enrich our experience with different viewpoints. And our main mission is to share our experience in all the policies that we are making as national authorities on digital health, on interoperability, on cybersecurity, on AI regulation, on implementation support, on stakeholder engagement from the clinician community, the patient community, but also the vendor community. All with the idea that we start to align our policies more and more globally, and then maybe even start to harmonize some of our policies, like in the interoperability space. And this is where I think the IPS really starts to bring its power. Next slide, please. So the GDHP is a group of countries, and the experts of these national authorities then come together and do workshops, and we did mini connectathons, that's what we call them. We started looking at what use case do we want to see if we can adopt the IPS in, and we started, of course, with the patient-mediated exchange. So a patient says, I want my data to be available in another country. Can we technically support this exchange? And this, of course, has to do with all the privacy regulation, that as soon as it's patient-mediated, there is consent implied, and then we can move forward. So what we've done is we've done a series of mini connectathons, and you can see the dates on the slides, and we developed and we supported the development of the IPS implementation guide, and the next one is estimated to be released this year. And of course, we used it as a forum to spread the knowledge and experience of how do you exchange patient data, how do you do this standardized. And other countries have adopted the IPS as well. So it's also meant to see if we can still exchange between the Canadian IPS on the one hand and the New Zealand IPS, that are both national implementations of these standards used to harmonize patient exchange or patient data exchange within those countries, and that they still conform to the IPS standards. Next slide, please. So, of course, we don't just do that as national authorities. We are part of a bigger ecosystem. So what we've done is we've engaged uh, uh, vendors and other organizations to be part of this. Google Health has done a demo that they made the IPS part of their open health stack. We have Drimpy is a personal health record company from the Netherlands that allows then patients to export their personal health record in IPS format and present that through QR code or any other means through APIs to a foreign doctor in this case. And there's others that we're still talking with, like Epic and Microsoft and even Apple. But there is no implied IPS commitment from them yet. That's what we're trying to work on together as countries. Next slide, please. So what makes the IPS so interesting for the countries, for the national authorities? Part of it is where it came from. So the IPS came about from a set of European and other initiatives to develop a European patient summary that has already been implemented for quite a while in several European countries and is already part of the core set of standards in Europe. Together with the US CDI core data set for interoperability. The thing with these two projects is, or these products, is that the national need for interoperability is very much defined in those processes. Like in the European EPSOS project, countries were part of the project group and then defined the need for interoperability and what the minimum data set should and should not contain. And this then got into the IPS. Next slide, please. And currently, the IPS is being maintained and managed at the Joint Initiative Council at the Cross-SDO coordination group. And you can see here, and this is a duplicate of the slide that Mike have already shown. Can you click to the next, and then the next layers will come, and yes, thank you. And you can see here that all the different SDOs that are connected and are engaged in the IPS, each has their own artifacts that they maintain and that need to remain aligned with the other artifacts from other SDOs. That there's a different level of engagement from the countries and the national authorities in defining what the interoperability need actually is. So through the CEN and ISO process, these are the national standards bodies which aren't focused on health standards but are broader on standards, like ANSI in the US. SNOMED has national release centers, HL7 has national affiliates, and IHE has national deployment committees. And they're all engaged in this, but there is not a lot of formal engagement from the country. So one of the things that from the GDHP we're very interested in is how do we engage with the SDOs to put forward our national and regional, for instance, like in Europe, with the European health data space, we have a European governance on interoperability. How do we put forward our interoperability need that is formalized through those national authorities? And this is how we engage then with the standards bodies and with the JIC in this. Last slide has an error on it, but that's okay. So we took over the secretariat and the chair of the GDHP from the United States, from Steve, who you saw talk in the session before this. Their secretariat email is still on this slide. If you go to gdhp.health, you will find our new Dutch GDHP secretariat email where you can reach out to us. Thank you very much. If you have any questions, please put them in the chat.
Thanks very much, Herco. It's a pleasure to have you on this panel, and I look forward to continuing to work with you in the years to come on this very exciting initiative. Stand by, because we may have some questions for you. And again, thanks for reminding everyone the chat's the place to put the questions, and also a reminder that if we don't have the time to get to them, we will definitely get back to you as part of the follow-up emails from this session. I'd like to now switch to our next presenter in the panel, Matt Rahn. As I mentioned, Matt is with ONC. Matt will present his perspective on IPS from his involvement personally, and also from the involvement of the U.S. and his involvement supporting the GDHP when it was part of the U.S. Secretariat. So Matt, over to you.
Thanks, Mike. Can you hear me?
Yep, we can.
All right, perfect. Thanks. Thank you for having me. Appreciate it. Again, Matt Rahn, I'm the Standards Division Director at ONC in the Office of Technology, and just wanted to thank you all again for having me. And you know, I think just so folks know, Steve is still the interoperability workstream co-chair of GDHP, and so I will still be heavily involved with Herco on this journey for the foreseeable future. So, you know, very much looking forward to that. Can you go to the next slide, please? You can click through. I didn't realize I had clicks on. All right. So Steve kind of talked about this. Him and I did not coordinate on what he was going to go forward through, but that's totally fine. Just a little bit of background. ONC was founded in 2004 and established in 2009. And we formulate the federal government's health IT strategy and advance our national goals for the interoperable nationwide health and IT infrastructure. And this was established back in 2009 via the HITECH Act, where we created a certification program for certified health IT products. And then in the 21st Century Cures Act in 2016, there was a requirement for access to information through APIs without special effort. And you know, that's what we're going to talk a little bit about today, like we've already been talking about. We're in the U.S. is very much on in a sense, FHIR forward path, but to get there, you know, there's obviously things we have to get through. But next slide, please. So specifically, and Steve talked about this, Herco talked about this, and Mike talked about this a little bit too. So back in, I don't know, it must have been like 2015, 2016. I think that was the beginning of our support of IPS. And at that point, there was no FHIR IG. So we helped support the publishing of the CDA IG. And then further on down the road, the FHIR IG support. So we have been providing support on the updates to the FHIR implementation guide. And a lot of those happen with the different IHE Connectathons, the Projectathons, the HL7 Connectathons, and LACPath Connectathons, as you saw on some of Herco's slides. We've been heavily involved in a lot of different ways with, you know, helping improving the implementation and adoption of the IPS standard. Even previous to, you know, being the chair, which in 2022 to 2023, Steve was the chair, and obviously, as Herco mentioned, Netherlands has graciously taken over, and very much look forward to working with them on that. And as I mentioned, Steve and Avi, who presented earlier, are the co-chairs of the interop workstream. And then, so we will be very much involved. I'll give a plug that Herco has a presentation at HIMSS. I think it's 11 a.m. on Thursday, and we can put info in the chat. And then I have got one at 1 p.m., I think, on Thursday of HIMSS, talking about IPS and the support GDHP has provided. Again, the International Patient Summary has been a project of the interop workstream since about 2020. It was clear that that was a project that had a lot of legs. So we've been working on figuring out the best path forward to push adoption. And the main use case was patient mediated. There was a lot of different policies to consider if we were doing, provider to provider type use case. And so that will come at some point. But obviously there's countries like Canada and others that are, working through towards that. And so, but for the purposes of GDHP, we did focus on the patient mediated aspect. So the last mini Connectathon we had was July 2023. And, we'll continue to do those just so that we can, keep pushing outside of the, the regular IHE Connectathons, the Canadian Projectathons, the HL7 Connectathons, just continue to push to move the needle forward. And then, the presentations, like we said, we've been, trying to evangelize the work at IHE, HIMSS, HL7 Working Group Meeting Plus, that was in May, SNOMED, I think Dev Days, we had a presentation or two as well. So just really trying to get out the word. Next slide, please. So again, this is like not the most up-to-date slide, but I wanted to just show that, as far back as 2020, 2021, we've participated in a bunch of different opportunities that a bunch of people on this call today were, part of, and very much thank you for that. Really, there's never been more excitement around IPS, and never been as much, push to adopt. So we're very excited about that. We want to make sure that the standards themselves via IHE Connectathons, that they are as implementable and adoptable as possible via testing. Next slide, please. So current status is most implementations are moving forward with the HL7 Fire implementation of IPS. Herco mentioned this. Later this year, there's going to be an update to the Fire IG. We will probably ballot with HL7 in September. And you'll see more info on that. There's discussion on May to December. We're trying to figure that out, or September. But then, John's going to talk about this, but IHE released the sharing of IPS in the fall. And then there's an IPS public website that a lot of folks around the world have been participating, and you can see like different presentations that have been given on IPS. Next slide, please. So this is one thing I wanted to plug, because Mike asked me to talk a little bit about how the US has been participating. And, since COVID, you've probably heard smart health cards, mostly smart health cards, but then smart health links is coming up. But, smart health cards, it allows you to have your vaccine history available on your cell phone, essentially, via QR code. And they tend to be smaller in size. And so since about January 2023, we have been working with the state of Washington to pilot smart health links to an IPS. So essentially a QR code for a link that takes you to your IPS. And so this has been a prototype we've been working on, and other countries are also very much interested. And Herco mentioned the Google Health pilot. They actually did a similar prototype. And so that's something, like, as he said, they have not committed to, but they've been, we've been trying to work with them to get, to push towards this. And we've been talking with Apple and others as well. But this is, what we felt as the easiest way for patients to get their data would be on their phone, right? So if they had a smart health link via QR code to their patient summary when they're traveling, it'd just be super easy for them to show that to the doctor if they needed when they were crossing any sort of border or territory. Next slide. And so this is just a little bit of background on how it kind of got started. Dr. Bryant Karas at the state of Washington, he's the CMIO. We met at a Connectathon, and they were just super interested in the IPS. But to start, they did put together a digital vaccine verification using Smart Health cards. And they deployed that in the state of Washington really quickly. And so they have nearly 2 million verification requests since October 2021. So it's super exciting. And it's a border state, so hopefully soon there's some opportunity with Canada there. So now they're adding what they're going to call WOW Verify Plus. Next slide, please. And I gave a little lead to this, but it's essentially an IPS to a Smart Health link. I don't know if the QR code actually works, but essentially it's an embedded URL and a QR code that links to your IPS summary. In the US, we have the US Core Data for our interoperability. They are actually working on, creating a QR code to that, but this is where we're starting. We want to focus on this. They have a heavy interest in being able to support international travel through the state of Washington. But this is something that just came up through a Connectathon, and we were able to have them support and join, not only join GDHP, but through the US. We've been piloting with them, and they've been sharing regularly their implementation. I will mention that the Smart Health Links is not a published standard at this point, but it will be very soon. And that is going through the process of, getting a project together to get that published. But based on all this work, it's been helpful for us to, look at, how does, is it as written, is it okay to publish that way? Or does it need to be updated before publishing? Very similar to like IPS. So much that we've done through GDHP and the Projectathons, the IG Connectathons, and the HL7 Connectathons and BlackPass Connectathons. We've learned so much from those, and that's all what we've learned through those is going to help update the new version of the FHIR IPS in the fall. And so there can't emphasize the importance enough. But this is one particular project that we've been focusing in on and learning a lot from over the past year or so. Next slide, please. So just want to give a shout out to Canada. They've had their Pan-Canadian Projectathon. They've been one of the leaders in the IPS adoption over the past few years, and looking forward to continue to work with them. Next slide. I think Attila's on, so thank you, Attila. And Avi was on earlier. And then again, New Zealand, they've done a lot as well. They're actually launching their international patient summary, which is going to be similar to like our US core data for operability, but their base standard will be based off of IPS. So just those are just two examples. I know Netherlands has a lot. There's a lot of countries in Europe that has a lot going on, but just wanted to highlight them. Since Herco was on the call, he could highlight them, Netherlands, but there's so much going on, and we're very much looking forward to all the different work that's happening. And I think that's my last slide. Is there another slide? You can go to the next one. Oh yeah, so here's just some resources. If you need gdhp.health, as Herco said, is a good one. But then there's IPS FHIR server, ips.health, and then there is that website again. And then John Demore, who's been a great advocate for IPS and our whole team. He put together a 5-minute IPS overview YouTube. So John has been doing a great work for us. I know Rob Hausman is another one that's been doing a lot of great work on IPS. So just want to thank them both. I'm going to turn it back to Mike. I think that's my last slide.
Thanks very much, Matt. Great to have you on board. And I just want to say that I live right across the border from the state of Washington and go to Seattle all the time. So if you're ever looking for, a participant from the north, I'm your man.
Let's do it.
I'd like to move to our last speaker now, John Murky. Everybody in IHE knows John, and everybody in HL7 knows John. He is everywhere. John, I'll let you introduce yourself and your fabulous project around SIPS.
Good morning, everyone. Good afternoon to those in Europe. Good evening. I hope you're not watching us if you're in nighttime. So, John Markey, I'm co-chair of the IT Infrastructure Technical Committee. Been involved with IHE for quite a bit, and really I participate in the HL7 efforts on IPS in addition to the ISO. So I'm have many hats here, but I'll focus first on the IHE work. So next slide. So this slide is predominantly what everybody's already spoken to. So I'm not going to spend a lot of time on this, except to express that what I'm going to be presenting with the sharing of IPS is the IHE participation in this cross SDO collaborative. So it fits right in, but it's not the only thing that IHE is doing. And you saw on some of the earlier slides, there is some work within IHE to support workflows like the EMS workflow or maternal health workflow. And in those cases, we're not really changing the IPS. We're expressing how the IPS can be used in those workflows. EMS needs to know what is your background before they start treating or would like to have that information. So we're utilizing the IPS in that way. And then we're also utilizing it in ways in which might do some further refinements or might have some alternates. So next slide. So like was shown with the Smart Health links, that's a really great way for a patient to participate in moving their IPS from one location to another. That QR code that was displayed, Matt, it does work. It brings up a sample IPS that the community has put up there for that demonstration purposes. And you can see the link itself includes the authorization. So if you have the link, you're authorized to gain access. That's the concept of Smart Health links. But let's go into the IHE world. In the IHE world, we have this document sharing infrastructure. Started off as XDS. We added XCA, XDR, XDM, blah, blah, blah. So we have all kinds of various ways to communicate documents. And we have this set of metadata. You can see the colorful diagram on the right there. Things relating to the life cycle of this document, things relating to how do I exchange it, how do I describe it, what is the patient identity that's associated with this, what is the provenance of this document, and then some security and privacy attributes so that the document can be protected appropriately. This metadata is content agnostic. We support this metadata on any kind of content. That content can be CDA and CCDA, as we see in the United States. It can be a FHIR document like the IPS, but it can also be DICOM documents. It could be a PDF. It could just be text. It can be anything. It could be a graphic. The concept of a document in document sharing is that it's just some stream of bits. It doesn't have to meet the criteria that CDA declares as documents, although we certainly strongly believe in those principles of a document that CDA originally purported. And really a long-term document probably has to have those attributes anyways. But those attributes are kind of baked into the metadata, so we can have metadata about any kind of document. One of the other attributes that I think is critical for support of things like IPS is that within document sharing, there is concept of being able to provide a transform of a document or to provide a signature of a document or lifecycle replaces a document. So you may have a previous document and you say, oh, by the way, we just updated this. So here's the replacement document. The concept of transforms is kind of shown in this EMR lineup here, where the EMR may publish predominantly a FHIR IPS, the thing we're speaking about here, but they may also provide then some transforms of that exact same semantic content. So you have a CDA or a C32 or a PDF, which are syntactic differences of that same content. So it's a transform. In this way, since there's a clear relationship, if someone gets a hold of the PDF, they can know that this PDF was a transform of the FHIR IPS. And if they then want to be able to get to a coded form of it, they have that linkages available. Or let's just say they have the FHIR IPS and hey, did somebody ever create a PDF rendering of this? The actual transformation is not magic within document sharing. It's a function that's available. So if a publisher wants to provide transforms, they can. There are some other things that I'm going to speak to a little bit more on the next slide, which is there are some special kinds of document entries, which is this on-demand or deferred creation. So here is the IHE document sharing layout. And on the left-hand side, you have source systems that are producing an IPS. We call them, a content creator. But effectively on the left-hand side, you have just systems that are creating IPS, much like have been tested, much like are potentially, not even aware that IHE exists. They are just simply producing IPS conformant content. On the far right, you have systems that want to consume IPS content. And you've had, there certainly have been some connectathons that take a source system and a receiving system and say, hey, produce a file, I'll import that file. And they're not using document sharing, but they're proving that they can produce something and that they can consume something. So then what we have in the middle is this document sharing infrastructure, which is a couple of different methodologies to support various kinds of deployment models of sharing of documents. So up on the yellow one is the most simple form where I just want to push the content. I, as the source system, know exactly who I want to send this to. So it's a push of the content. I might be pushing using MHD, which uses FHIR document reference resource, to just push this content to a recipient and say, here it is. I might be using XDR, which is a SOAP-based reliable transport, which supports this push. Or I might be using XDM, which is a way to put this content into a file system for maybe a USB stick or CD-ROM or DVD, or so that file can be carried within an email. And example of the Direct project is an example that uses XDM as its metadata wrapper around some content in some cases. So we have 3 different push models, and it's predominantly based on the kind of technology that you want to use. Number 2 is talking to our pull. We'll say pull, but it's pretty much publish and query retrieve. But the grandfather XDS, really has all of these children. So it really is the grandfather. XDS provides a way to have 1 or more document repositories. They might be specific to the source. They might be central. A registry that holds just the metadata and pointers to those repository copies. And then on the receiving side, a way to query for document entries, folders, submission sets, determine from the metadata which documents you want, and then pull that document and consume it. With XDS, we federated that with XCA for communities. XCA is really predominantly only the right-hand side. There isn't really a publication in there unless you're publishing into an XDS environment. And then we have MHD, which is, again, FHIR-based, using the FHIR document reference and some other resources to support folders and submission sets. MHD itself is really just an API to these document sharings, but there is an MHDS which is a completely FHIR-based infrastructure. So if you like this kind of a concept of document sharing, but you are in a green fields and you want to use just FHIR, MHDS brings those things together. MHDS brings not only just document sharing, but patient identity management and vocabulary management and personnel management and endpoint management with directories and such. So that's this set of pull, the number 2 here. And then I said I was going to speak to this on demand, which is really shown in number 3, and we kind of have it as a special. It really is a variation on 2, but it is radically different and especially important for things like summaries, like the IPS. With an IPS, if you want to consume an IPS, you probably want to consume the freshest of data. You don't care about an IPS that was published 20 years ago. You want, hey, what would the IPS be today? So on demand enables us to do this. A source system can publish an entry, a metadata entry that says, I can create a fresh IPS if you want it. So it's a contract. It says, hey, I'm willing to create one. And then when someone comes along and says, oh, I'd like that, then that IPS would be created. There are methods to make a snapshot of it so that you don't have to hold on to it. And then, these IPSs will have these various relationships, which was shown earlier. So the on-demand really becomes very important with an IPS because you can get the freshest of information. So next slide. So really these 4 bullets are the requirements that are in the sharing of IPS, because the sharing of IPS predominantly says, hey, the IPS content has to be conformant to the FHIR IPS implementation guide. We're not going to change the content. That's the content. We're using that. We defined a format code because in the metadata we have this concept of a format code, which is kind of a indicator to a recipient what was the intended profile that this covers, and we came up with a format code which says it was the HL7 IPS. Specifically, we used the profile canonical URI for that. And then we said content creators and content consumers must be grouped with at least one of the document sharing transports. So again, we're saying, hey, XDS is there, XCA is there, and those kinds of things. So you need to declare that you have support for at least one of those. So within your integration statement, you can see this content creator supports XDS and MHD. This one over here supports just MHD. So, hey, MHD will work. If they don't have something that works, usually there is some infrastructure that translates between them because the metadata is very translatable. And then we have this vague requirement that content consumers must have some use of the content. Maybe it's view, maybe it's import, those kinds of things. So next slide. So what are we doing at an IHE Connectathon? So an IHE Connectathon, again, if you'll note from the previous slide, we're reusing a lot of the content that has been created. So testing of the IPS, we use the HL7 MITRE validation tools. Testing of document sharing, we use the IHE Gazelle NIST test tools. Testing of the IPS can be queried and retrieved is just a configuration of those testing tools. And when an IPS is requested and an IPS is delivered, we can then take that from step number 2 and send it off to step number 1 and prove that, yes, indeed, this content was conformant. So it's really just a reusing of things that are pretty mature. We do have this concept of higher level use cases. I mentioned this before, transfers of care, EMS support, maternal health. These are some uses of the IPS as content within a broader workflow, which is really what we want to be able to focus on, is rather than focusing on just IPS, focus on how IPS can make these broader use cases far more effective. And then regional specializations, as you heard earlier. Those are some other things that we can do at Connectathon. So I think that's all I have. Next slide. Everybody else has put these similar up there, but these are links you can go to. The HIE white paper is probably the new link that you haven't seen on the previous ones, but that explains this whole document sharing infrastructure. Thank you.
Thank you very much, John, as always. And we're a little over time. I noticed there's a question in the chat, and I think it's going to be directed to you, John. So if you could take the time, perhaps during the next panel, to perhaps pen an answer to that, that would be really helpful. Otherwise, we'll pick it up after if not. Okay, thanks very much. And I'd like to thank all the panelists. It was a great overview of IPS and where it's at today. I think it'll give us lots of things to think about, and perhaps even more so, make plans to stay involved or get involved with IPS in the future. So with that, I'll send it back to Christina, and we'll see you later when we get through the virtual tour.
Excellent. Thank you all for an amazing panel. It is, we're so appreciative of each of the panelists' leadership and you sharing what you're doing to advance the International Patient Summary across the globe. With that, I'm going to introduce our next panel.